Hi, I'm Peyton Hester and my major is exercise science. Over the past few weeks, I've been researching the story of an 8-year-old boy named Zion Harvey who is the first pediatric recipient of a bilateral or double hand transplant in the summer of 2015. Zion Harvey is a young boy from Philadelphia that was unfortunately diagnosed with sepsis at the age of 2. According to Mayo Clinic, sepsis is a complication due to an infection. Certain chemicals are released into the bloodstream to help trigger an inflammatory response. This inflammation can start a domino effect of failing organs. If sepsis progresses to septic shock, it could potentially lead to death. When Zion developed sepsis, he had to have both of his hands and feet removed, as well as one of his kidneys. His mother underwent an organ transplant and donated her kidney to Zion. Zion was deemed an excellent candidate for the surgery due to many reasons. In order to be able to receive this transplant, a patient has to take an immunosuppressant in order to prepare the body physically. An immunosuppressant strengthens the immune system and is also called the anti-rejection medicine according to HealthLine. The main use of this medicine is to prevent the rejection of new organs in organ transplants such as Zion's. Zion had been taking these immunosuppressants for several years due to his kidney transplant, causing his body to be used to the drugs and ready for another. Aside from his body being physically prepared, Zion also had to be mentally and emotionally ready. Scott Levin, the doctor that led the surgery, mentioned that one component that's ongoing but started very early was making sure that Zion felt comfortable with the idea of having new hands, looking at them, and connecting with them. Just like Dr. Levin mentioned, Zion had to be able to see these new hands post-operation and know that they're his. Zion had such a bright outlook on life, according to CHOP, the Children's Hospital of Philadelphia, that he was almost immediately deemed a candidate. In the few years it took to plan and prepare for this surgery, not once did Zion falter from a smile or begin to doubt anything. He always had a great reason to keep smiling and going forward with this. And remember, this little boy is only 8 years old. Along with his positive outlook on this all, Zion also had an extremely supportive family to fall back on and help him through it. Zion was now considered more than ready. Now that Zion was mentally and emotionally ready for this adventure, the day of the surgery had come. Dr. Levin mentioned that this surgery was the result of years in training followed by months of planning and preparation by a remarkable team. They, those chosen to participate in this historical surgery, had to learn exactly where everything goes, what everyone does, and how this is going to work as a whole. The 40 doctors present consisted of physicians, nurses, plastic surgeons, orthopedic surgeons, anesthesiologists, and radiologists. Out of these 40 doctors, they were divided into 4 different teams to take care of this 11-hour surgery. There was one team for each of the donor hands, and the other 2 were focused only on Zion and preparing him. The doctors responsible for the donor hands had to receive them from the donating hospital, package them correctly so they would survive the trip to where Zion is, and make sure that they made it safely in the end. Without these hands in perfect condition, they would not be viable and could not be used for Zion's surgery, proving unsuccessful. This was, all in all, the main and most important step to the whole surgery. The doctors working with Zion had to prepare him by making sure his body was ready for the new hands. In order to do this, they had to open up Zion's arms and had to find and correctly identify every single muscle, tendon, artery, vein, and nerve. If just one of these were to be missed or incorrectly labeled, the surgery would more than likely fail. According to Johns Hopkins Medicine, the human hand consists of 27 bones, 28 muscles, 3 major nerves, 2 major arteries, multiple tendons, veins, and soft tissue. This is a lot of pressure on those 40 doctors. The surgery was led by Dr. L. Scott Levin, the chairman of the Department of Orthopedic Surgery and a professor of surgery at Penn Medicine, as well as the director of the hand transplantation program at CHOP, the Children's Hospital of Philadelphia, according to the article provided by the Advanced Healthcare Network. After surgery, Deborah Humpel was the physical therapist that oversaw Zion's rehab. Dr. Humpel is the outpatient occupational therapy supervisor at the Children's Hospital, says the Advanced Healthcare Network article as well. In order for all this to be possible for the Harvey family, there were several sponsors that provided. While watching a video made and posted by the Children's Hospital, there was a slide with a list of sponsors. This included organizations such as the United Network for Organ Sharing, Shriners Hospital for Children, and even the Children's Hospital of Philadelphia, as well as many more. The United Network for Organ Sharing is a private nonprofit organization that manages the nation's organ transplant system under contract with the federal government, says the United Network for Organ Sharing website. UNOS is president in many of the aspects of the donation process, all the way from managing the list and matching donors to educating the transplant professionals. Shriners Hospital for Children provides advanced care for children with orthopedic conditions, burns, spinal cord injuries, and cleft lip and palate, according to the hospital's website. They have a list of missions including providing high-quality care for children, providing education to healthcare professionals, as well as conducting new research to better the future for children. The Children's Hospital of Philadelphia is the nation's first hospital devoted exclusively to the care of children, according to CHOP's website. It also states that CHOP strives to be the world leader in the advancement of healthcare for children by integrating excellent patient care, innovative research, and quality education to all of its programs. In order for all this to be possible, the surgery had to happen in a series of steps. If one had a mishap or anything went wrong with it, the following step could not be done. According to the story posted on the Advanced Healthcare Network, the first step they took was to attach the donor hands to Zion's arms by connecting the bones with metal plates and screws to ensure stability and growth in the right direction. Next, they had to carefully attach all the arteries and veins to create blood flow before continuing any further. Without blood flow, the tissue dies and the surgery is unsuccessful. After attaching the arteries, the doctors had to individually connect each tendon and muscle to provide Zion with full function. Before being able to close the surgical site, the next step taken was to connect the nerves so Zion would have feeling in his new hands. And finally, his wounds were closed and the surgery was complete. USA Today posted an article of Zion's historical surgery on July 31, 2015, which was soon after the surgery was complete, but before Zion got to go home. They quoted Dr. Levin saying that Zion started therapy just 1 week after his operation and only improved with every passing day. Zion will undergo intense hand therapy for the next few months and could possibly take up to 2 years before he meets full potential. Deborah Humpold, the outpatient occupational therapy supervisor at CHOP, mentioned that his therapy included passive and active range of motion. The Houston Chronicle article, Live Healthy, explains that active range of motion is when you, the patient, physically move your joints as much as you can. On the other hand, passive range of motion is where the physical therapist, doctor, or someone other than the patient moves the joints himself. Zion will have to be closely monitored and have to take immunosuppressant medicines the rest of his life to make sure the new hands never become rejected. Because of his previous kidney transplant, he has already been taking these drugs, causing his body to already be used to them and doing what they're supposed to be doing. One major side effect of these medicines is that they cause a higher risk of infection and some people to develop cancer, says USA Today. This double hand transplant matters not only to children who may need and receive them, but also to the doctors who are performing and studying their success and failure rates. In one of the videos I recently watched, one of the doctors talked about how he planned on this changing the lives of hundreds or even thousands of children around the world. In 5 to 10 years, we may never see another child without any hands or without any feet if this kind of surgery continues. But it may be a lot harder to approach parents after their child has passed and ask them for their child's hands or feet. If more children need these transplants and get them, then physical therapists are going to be in higher demand to stick by the sides of these children to see their rehab through. The requirements of a physical therapist could possibly change if they happen to be one of the many chosen to work in this environment. This story is connected to a variety of disciplines. One example is engineers because they have to, essentially, make the prosthetics to help structure them to provide full mobility and stability of the human body. Not just with prosthetics, but also with any braces that are made like the one Zion had to wear post-operation. Another discipline that is related is biology for many reasons. They have to pair the DNA and the blood and any other feature that goes into bodies and skin and pair that with the features of the recipient's body. You can't just take any organ from any person and put it with whoever you want to. It'll be rejected and almost fail immediately. And finally, the last discipline is surgeons because they are the ones performing the surgery and, in a sense, they give physical therapists a job. The way multiple studies are combined into one is absolutely incredible. If this research continues to grow, there may never be another child with prosthetics. Zion's surgery has been a success up to this day and continues to change the world. Many children around the world will be able to live normal and healthy lives. We've already been able to successfully transplant hands on adults, but being able to help children in the same way is a complete game changer. The doctors will study Zion and make sure that they note down every step they took to change the world for all the children in need.